NG insertion, take 1.
Come in.
Hi, Mr. Shambon. My name's Chris. I'm your nurse today, and I understand that you have been having trouble keeping food down, that you've been vomiting a lot lately. Is that true?
Yes, that is true.
Well, I guess I should start off by, I introduced myself, but now I want to make sure that I have the right patient. Could you tell me your name and your date of birth?
Marty Shambon, 5863.
That's correct. All right. Well, you have orders that I'm supposed to be inserting an NG tube. That's a tube that's going to go in your nose, and it's going to go down in the back of your nose and go down to your stomach. And then we can put medicines in there, and we can also flush it so that we can get the contents out if you're having a lot of nausea. Do you have any other questions?
Will it hurt?
It'll be very uncomfortable, and I'm going to give you some water to swallow. So as I'm inserting the tube, it will go down easier as you're swallowing.
Okay.
Okay? All right. Let me wash my hands. And I'm going to go ahead and get my gloves on. This is not a sterile technique, but it is a technique where I want to make sure that I keep everything clean. I'm going to raise up your bed just a little bit so that you're at a better height.
Okay.
Right there is really good. I'm also going to need to have to sit you up a little bit so that you're in a more closer to a 90-degree angle. So if you could sit up. Okay. And then I'm going to make it so that you can tip your head back just a little bit. Okay, that's really good. All right. We have our tubing.
Sure that tube's gonna fit?
No, it's not going to fit. Fish tubing.
It's a big one.
Okay, and then I have my syringe. We have our lubricant. Our tubing has got markings on it, but we're also going to measure so we make sure that we have everything in the right place. I also have our tape. Okay, so I'm going to measure from your nose over to your ear.
You're gonna put it through my ear?
No, this is just helping me get a rough estimate to know how long it's going to take to get down into your stomach. So then we're going to go from your ear to your xiphoid process, which is about the top of your stomach. So this is about the point where I want to have the NG tube inserted. So I'm going to put a marking on the tubing right there. Okay, so that's all ready for us. And then I'm going to get some tape ready so that I can wrap and get everything on your nose to hold it in place.
Looking forward to it.
You excited? I can tell. Have they been good to you in the hospital so far?
So far.
So far. Okay. All right. So we have our tubing all ready. I have it all lubricated. All right. What I need you to do is look up to the ceiling, and then I'm going to have you swallow as I'm pushing on the tubing. So here you go. Swallow. 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 And now we're at the tape point. So now we can tape it into place. And I'm sure this is very comfortable.
Awesome.
Sorry. Now normally what we like to do, and I will do this, I'm going to send you down to X-ray, and they're going to verify that we have this placed in the right position. But right now I'm going to just check with my stethoscope and listen to your stomach, and I should be able to hear the gurgling as I'm inserting my syringe pushing the air in. And as I'm inserting that, I can hear the gurgling in your stomach. And then I also wanna make sure that we have stomach content coming back. And I see that I have the yellow green that's, looks like stomach content. So now, that'll stay in your nose, and this will be your substitute. You won't be able to eat or drink. I'll give you all your fluids through this tubing, and I can come in from every 2 hours, and I can swab inside your mouth, but we don't want you to drink anything while you have this tube in. And then we can also give you your medicines through the tube. But right now, the doctor just wants to make sure this is inserted so that you don't have any more episodes of emesis or nausea. Do you have any questions?
Mhm.
Okay, Mr. Shambar, I'm gonna lower down the bed, and I want you to make sure that you keep yourself at this 30-degree angle. We don't wanna go any flatter because you have this tube inserted right now. So, make sure that you call for help if you need anything. I have your call light right here, and you can just push that button and someone will come in to help you. Thank you.